dedicated to empowering you with information
to make positive choices
and be advocates for your overall well-being.
Welcome to The Health View. Welcome to The Health View. I'm Yvonne Dunetz, and our guest today is Reverend Rosemary Lloyd. We are delighted to have you, Rosemary, because today we're going to be talking about a conversation that's most important to you, related to what it is that you want others to know. Rosemary, let's jump right in and talk about the Conversation Project, your role in it, and why it's important for you personally to be part of the team.
Well, thank you, Yvonne, and thanks for this invitation to be with you up in New Hampshire. It's great to be able to connect with you this way and to share our message. So you're right, I'm working with the Conversation Project. We are a national campaign, a public health campaign, actually, to support people in having their wishes for end-of-life care expressed and respected. So there's a gap there, right? We want to be able to have people have a conversation, and then when it's critical, when it's time, we want all of our healthcare providers to be able to respect those wishes. But it starts with having a conversation about what matters most to you about living. So we've developed a number of free tools, including a starter kit guide, because so many people say they think they should have this conversation. In fact, 90% of Americans think they should have the conversation, and you and I know in this election cycle, 90% of Americans don't agree about anything, but they all agree we should be having this conversation, but fewer than 30% of us are actually talking about what matters to our loved ones and our healthcare providers. So this is what we're doing. We are helping people by providing this free starter kit. It's on our website. You can download it for free, share it with whoever you want, and then use it to prepare to have that critical conversation with your doctor. Because in order for it to be respected, you also have to make sure your doctor or your nurse practitioner are in the loop about what you want.
And whenabouts do you start a conversation like that?
Oh, well, that's a good question, because so many people think that they don't have to have it yet, that they're too young, or they're too healthy, or there's just really no reason to have it, but more likely it's that they're afraid to have it. And more and more when I talk to people, as you mentioned, I'm Reverend Rosemary Lloyd, so at the Conversation Project, we aim to reach people where they live, where they work, and where they pray. And I'm the pray part, basically. I'm a Unitarian Universalist minister with a background in healthcare. I was a nurse before I was a minister. And we get people to start talking about embracing the reality of their mortality. Because, that's what they say, birth is actually fatal. None of us is getting out of here alive. So all of us really need to be having this conversation, and it's never too soon.
Rosemary, people do living wills, they do health proxies, they make certain statements, some of them. How is this different from that? Because this takes the conversation, I believe, much more thoroughly into the direction of the wishes of a person beyond what's on writing.
Well, you know what happens sometimes with the writing pieces, Yvonne? People get a will and they go to their lawyer and then they file it with their lawyer. Or maybe they made out an advance directive and then they put it in a very safe place like their file cabinet or their safety deposit box, and no one can ever find it when they need it. The thing that you can always find is a conversation with a loved one, because chances are when you need a critical decision made and you cannot communicate yourself, your loved one will do it for you. So this is a conversation. If you've talked about what matters most to you, that person is going to be able to answer the question in the really short moment where a critical decision might have to be made.
And it's important that the loved ones are all on the same page.
Yes. So the starter kit, I'd love for us to be able to come right up there and do a whole workshop with you using the starter kit, but anyone in your community can take that starter kit from our website and lead a group at their church or at their PTA or at their Rotary Club and do it together as a group, because it's really supportive that way. And you get to talk about things way beyond the weather and sports teams. You get to talk about what matters most to you.
And I'm hoping we can begin that dialogue here. It's really important. But how did it touch you, why you decided to get involved? How did all that happen?
Yeah, well, it's interesting. I grew up with all four of my grandparents living in our home. So my mother, who should be nominated for sainthood, took care of her parents and her in-laws. And so as kids, we grew up seeing what it looked like to get old and to die in different kinds of ways. And that may have been what led me to nursing in the first place, wanting to help take care of people in all these different ways. But I've always been very interested in how we die, and that there are good ways and there are hard ways. And I've seen some good ways in my family, and I've seen some very tough ways in the hospital where families haven't talked. And there have been fights at the bedside, including in the ICU, with two sisters literally coming to blows because one of them was saying, well, Mom never told me that. So it's so important that we talk to all the stakeholders, all the people who would have some sort of a say in what happens to you at the end of life, so that everyone is on the same page. You know, we have done a number of studies, and we found out that 60% of Americans say that it's really important that our loved ones know what we want, so we won't be a burden on them. And yet, we haven't had those conversations, and so we are a burden. We're burdening loved ones with making decisions without having a voice in our heads. You know, what did Mom want? Well, I remember her telling me. In fact, that's why Ellen Goodman, the founder of the Conversation Project, started it. Her own mom had late onset dementia, and as Ellen sometimes jokes, Mom couldn't decide what she wanted for lunch, much less what she wanted for health care. And Ellen was her healthcare agent, the person who makes the decisions. But they hadn't talked about what Mom wanted. So Ellen said, I was confronted with a cascade of decisions that I wasn't prepared to make. And after her mother died, even though she did her very best to care for her and make decisions, she said, I felt guilty. I felt I had some remorse that I hadn't brought this up. It was a complicated grief process for her. She said, I never want to see anyone else go through that. So she started the Conversation Project.
So what are the types of questions that people need to engage in to start this conversation? Because, you know, in life, here you're talking about conversations at the end of life. A lot of people haven't had these conversations during their life related to their wishes, the difference that they make in life, their purpose, how they want to be happy in life. They haven't had it. And from your perspective, treating the mind, the body, and the spirit, what do you answer to that? If you haven't been communicating before, how do you communicate now at the end of your life? And how do you bridge that gap?
Yeah. Well, my first mission is to convince you and everyone listening that it's not too soon to have this conversation. In fact, it's always too soon until it's too late, right? That's what people say, it's too soon, but then it's too late. So we'd like to see this normalized. And I'll tell you from the faith perspective, there's a saying in one of the Jewish texts that this is the day the Lord has given. Let us rejoice and be glad in it. Well, my feeling is you can start thinking that your time on earth is limited. Well, what if you took every day, this day, and made it the best day possible? Well, you only do that if you realize I'm mortal. I'm not going to be here forever, so I don't want to waste any time. So let's start with talking about this is your good day. Make it the best day you can. But to share with someone else, what's so important about it for you? And the first question we ask in our starter kit is, when you think about the end of your life, or you think about living, what matters most to you? And we give people a few minutes to think about it and then write it down. And like I could just ask you right now, you know, what matters most to you?
For me, it would be my family and my animals. That would matter most to me. My husband, my children, my grandchildren, my wonderful, endearing pets that are my souls that have been with me for years. That would matter most to me, and I would want to know that they would be at peace, that they would be well, that I have made the decisions I needed to make so that I wouldn't have been a burden to them, and that they, knowing that life is a full circle, would understand, and I could role model for them to live a full life, to grasp every bit that we can together, and that the time where it comes, where time is drawing to an end, that we can do it in a beautiful, loving way, and each of us depart peacefully, but knowing that love is eternal.
Beautiful, beautiful. And so sharing that with the people that are closest to you, that they hear that statement from you, first of all, it acknowledges your love for them. And how great is that? When we realize we have to say these things, we spend more time saying, I love you, or I'm sorry, or please forgive me, and I'm so grateful for everything. And that makes a life worth living, right? Without regrets at the end.
That's the key.
So,
No regrets at the end.
no regrets at the end. So start sooner, not later. Don't wait for a crisis. So that's why we encourage people to do this at any age, to do it at major life events. We even think it's important to talk in family groups, and we try to promote this right around Thanksgiving so that people will literally talk turkey at the Thanksgiving table when everyone's together. One woman told me she had a campaign to no pie until you tell me how you want to die.
No pie, along with what they're grateful for.
And what they're exactly, because this is a gift you give your family.
So
It's a gift you give them.
it truly is. It's
Yeah.
that lasting parting gift of understanding that we are here for a very short time. And we have to seize the moments and let's work together when the moments become drawing near and beginning to end.
Yeah.
So what other questions would you want people to ask each other to engage in the conversation?
So it starts with asking yourself. That's one of the things we talk about. A lot of people call us and say, oh, I need to talk to my mother about what she wants. And we say, well, you have to exemplify this conversation by having it yourself first, because you have to see there are challenges to answering these questions, and they just don't always come tripping off our tongues. So it takes a little reflection time. So practice it yourself first. Then you can ask others after you know for yourself things like, how much do you want to know? If there's bad news or news about your health, how much do you want to know? Versus how much do you want to just do whatever, but don't tell me about it? How much do you want your loved ones involved in your care? Where would you want to be if you were very sick or could no longer communicate for yourself? So there are some questions like that we ask people. We don't jump right into those questions that include, well, do you want to be resuscitated, or do you want to have artificial nutrition? Those are further down the line to be had with your doctor when the time comes. But thinking about what matters most can help people decide, well, would this give her the quality of life that she said she wanted? If so, let's pursue this treatment. So it takes away the scariest parts of the medical decisions and starts with the easier part, what matters most to you about life.
You know, it's interesting, you talk about end of life, but nowadays with people with the drug problems and suicide and all these different things that are going on, this conversation is so important really earlier than later, because you want to be able to know when you have people with drug addictions and things like that, what to do, how to help them. Are you finding that your conversation project is literally extending beyond just the end of life in the end of years, but now being viewed as a conversation that needs to take place at a variety of different markers of one's life?
Sure. Our organization is called the Conversation Project, but we should have called it the Conversations Project. So multiple, there's no one monolithic conversation to have. There are many to have over time. The issues that you point to are very complex, and they're not something we get into that much. Issues of mental illness, issues of opioid addiction. But they are important. If we've had these cultivated conversations all the way along. For example, we think it's really important that you talk to your college-bound child, because your 18-plus-year-old kid leaves town, maybe goes to another state.
Yes.
They're considered an adult in that state.
Exactly.
And as parents, if you want to be able to have some right to making decisions about their health, say the kid has to have an appendix taken out, you want to be able to make decisions, you better have a healthcare agent designation, a healthcare proxy form for your adult child so that you could be involved in that healthcare.
And each state is different. Some will accept it from some states or not, but you can go online to get that. But that is
Yes.
an important thing that a lot of people don't realize. You know, a child goes off to college, or they go off and move in their own independent way to start their life. These are
Right.
conversations and documents that need to take place. And you mentioned about the health proxy before, that sometimes people leave it in the vault or in a cabinet or whatever away from. It's important to always have a copy of your health proxy at home,
Yeah.
easily
This
accessible.
Yes, this is a challenge that we're working on. People are working on it all over the country. How to put that information in either a centralized location or make it something that's in your medical record that's readily accessible wherever you are in the healthcare system. So, right now we want this to be like the allergy analogy, we call it.
Yes.
Whenever you go to the doctor, one of the first things they ask you, do you have an allergy? And do you say yes or no? You say yes. Do they ask you anything else? Of course, they ask you follow-up questions because that's important, preventable harm that could be avoided if we know the information. Well, with healthcare proxies, we either say, the doctor might say, do you have a healthcare proxy? You say yes or no, and that's the end of the conversation. We want to see more and more healthcare systems kind of pursue that conversation. Well, who is it? Who is the person we would need to contact? And have you had a conversation with them about what's most important in case we need to ask them in a critical time?
Why couldn't that healthcare proxy, when you're having that conversation with your doctor, a copy become part of your record?
It can. You can bring it in, they can scan it and put it in your medical record. It's just that right now, some of the electronic medical records are so complicated that not all the systems have it in a place where you would be able to click and find it easily.
So if you went into an emergency room, they wouldn't be able to see it unless they had an integrative system in their computer basis in order to immediately pull it up.
Exactly.
That's
And
something that they need to advance on.
they need to work on this. I mean, people have asked questions like, well, why can't it be a requirement of getting a driver's license? Or why can't it be a requirement for if you get health care insurance, should you be asked, do you have a health care proxy? We're doing a project right now down in Howard County, Maryland, where the county itself has decided, well, the hospitals and the nursing homes and the EMTs can't all talk to each other on their electronic records. So we're going to keep a separate centralized record. So any of those institutions can dial in or log in and find the information on a centralized computer system.
That would be great, clear across the country. Wouldn't that be amazing? So if you were vacationing or whatever and you had that, they could immediately pick it up, access it, and have your wishes right there. That makes sense and would probably be most cost effective because then they wouldn't be doing lots of other measures if in fact you've already designated that's not what you want.
Yes, there's too many terrible stories about that where people have been treated when they've asked not to be treated because they have a very serious life-threatening underlying disease, for example, and didn't want to be resuscitated but were because no one could find the form.
Oh my goodness gracious.
Yeah.
So tell me more about this, Rosemary. What have you found to be the biggest challenges about having this conversation, especially in let's say, the healthcare field? Is that a particular challenge where that conversation perhaps may not be occurring as well as in the home?
It is a challenge, and I have a lot of empathy about this challenge personally because I know that doctors and nurses are trained to save lives and to cure people, make everyone better. It's hard to know when's the moment to step back and pause and say, wait a minute, is this what this patient's goal for care was? Is this the right thing to be doing now? Because it's set up to look like a failure if someone dies, but death isn't a failure. It's part of life. It's what happens. It's going to happen to all of us. But if you're driven to save, to cure, it's hard to pause. So I think more and more people are learning to pause, and certainly we're talking more with medical students and nursing students and residents to try and get them to think about this as part of holistic care, but also really care, deeply caring care, to be able to ask what matters most to this patient, and is this treatment going to help them get that?
And that is a really deep caring to be able to show that. You know, nowadays, before people would have a particular doctor and they might be with them all their lives, right? That primary care doctor or family doctor. But now they have a lot of different people taking care of them, and maybe not that consistency of that care. But
That's why it's important to talk to your family and make sure your family understand, because they're going to be your best advocates in whatever place you're in, whether you're in the hospital or a nursing home, a rehab center, or hospice at home. Someone else needs to know, and that's why you need to have the conversations. And as I say, it's a loving conversation. So many people tell us when they think about, oh, I'm scared, or my mom doesn't want to talk about that, or my kids say, oh, mom, don't die. You're not going to die. You're too young. So people want to push it off because it seems like it's a scary conversation. I can't tell you how many people say to me that I don't care how much education they have. Somewhere back in the back of their brain, they think if I talk about it, it's going to happen.
You're right.
And
that's true.
Isn't it amazing?
It is.
But it's not going to happen just because you talk about it.
So talk about that a little further. How and what would you say to people to help them to be at ease and kind of in a loving, caring way, help to encourage them that this conversation is really a conversation so important and so worthwhile that they will be very happy and not in any regret to have had it. How would you, from the basis of where you come from in your loving heart, help our listeners to understand, if not now, when? To really seize that moment of beginning to engage in this conversation?
Well, I think there are a couple of ways to start the conversation. For example, so I'm a mom and a grandmother, and I've talked with my adult children. But one of the ways to bring it up is to say, there's something I'd like to talk to you about. And then they get a little nervous, like, uh-oh, what's wrong?
Right.
And then I go quickly into saying, I'm fine right now. I'm actually healthy and having a great life. But I want you to know I've seen things happen suddenly in other people's lives, and I don't want you to ever be left in the dark. So I'd like to just tell you a few things that are important to me, and maybe get it down to 3 things. Like, really think about it for yourself. What are the 3 things you'd want someone to know? And they can be serious, and they can be funny. I had one woman who said to me, I hadn't thought about this, and when I thought about it, I thought, just remember, I don't like my feet tucked in too tightly. Keep the sheets a little loose around my feet.
Right.
So I think the idea of starting it's a conversation that starts with love, that I love you and I want you to be able to not be conflicted over this. I want you to feel okay. And for some people, the thing to say is, I don't actually know, and I do trust you, and I trust you so much that whatever decision you make, I don't want you to feel guilty about it. Like, release people from guilt in advance.
Exactly.
If that's what is, because the decisions we think we can make from this place here with our, as I say, our present tense body, our present tense minds.
Yes.
But we don't know all the circumstances for the future. So just releasing your loved ones in advance from any sense of guilt and saying, I know you'll do your best, and I will never hold this against you. So,
That's beautiful.
and everyone tells us when they have the conversation, they were nervous about it first, they come back and they tell us, oh, I'm so relieved, or we cried and we laughed and we held each other and we feel so much closer. Now, this isn't true for everyone.
No, it's not, and let's talk about that.
Yeah. Well, some people will just push it away. I had a call from a woman today from California. She said, I've been trying to talk to my 93-year-old mother for 10 years. What should I do? And I'm like, chances are she's going to not make any decisions and tell you about it. But you can let her know how much you love her and how much it would mean to you to have her voice in your head. And if she says no again, then maybe the best you can say is, then Mom, I just need you to know that I will do my best because I love you to make all the right decisions.
Rosemary, again, that is so beautifully put. And you're speaking about verbal conversations. Sometimes it's difficult for people to voice verbally in front of their loved ones and engage in conversation. I know that people now with technology do a lot of emails and things like that, but they shouldn't forget about the thought of writing a letter. Writing a letter, communicating and asking the questions from a loving heart, and being able to say, this is what I would like to know. If it's vice versa, and let's say in that particular example that mom didn't want to answer those questions, but can you imagine receiving from your loving daughter a beautiful letter telling you how much she loves you, and just wanting to know certain information so that she wouldn't have any regrets, and that mother would have peace of mind, knowing that she would, when the time came, do the very best, but wanting to know her wishes. Have you found that writing letters is another way to have the conversation when somebody's having difficulty verbally doing it?
Oh, I have so many stories about, the answer is yes. A letter is a great idea, and I have a couple of stories. I'm going to tell you one. I'll tell you first, though, there is actually a project called the Stanford Letter Writing Project, and you can go online and look at that, which gives you some guidelines for what to include in the letter. So that's the Stanford Letter Writing Project. But I know a woman whose mother had written out all of her advance directives and had them typed up by a lawyer. And it came time, and mom was having some very serious illness issues, was in the ICU, and the doctors had approached the daughter and said, we have to make a determination here about withdrawing life support. And the daughter was like, I know what my mother wanted, but I just am having such trouble following her wishes, that she pulled out her mother's advance directives typed up by the lawyer. And at the very bottom was a handwritten note from her mother directly to her saying, Dear M, if you're reading this, you must be in such a difficult situation. I'm so sorry. But please, we talked about this. Please do your best to honor my wishes. Love, Mom. And the adult daughter said that was the handwriting that had written every birthday card and every Christmas card to me. It was like her voice coming through. Exactly. And so even though it was hard for me, I did what my mom wanted.
There you go. And that's why it's so important. And so that writing, that message, even if you've had the conversation, being able to write it and have it there, so there's that note that remembers in the time that you need it, to hear that voice. Because that voice is something that they'll live with for the rest of their lives. Plus, it's a great model for them to know. You get such peace in that regard. What other things would you recommend for people?
I would recommend, spreading this as far as you can, talking in your family, but if you're the kind of person who's up for doing it, also taking it to your congregation. We're running a project this fall called Conversation Sabbath, where we're inviting clergy of all denominations to preach about this during November 11th to 20th. So right there, you reach lots of people all at once with a message. It's so important to have this conversation, and it gives you a chance to teach from your faith perspective. Why do we think this is important, and what's a faithful conversation to have, and why can we be courageous and loving in having these conversations? Because our faith models that for us and teaches that. So I would say, if you're a clergy person, take this on. If you attend some sort of a worship service, talk to your lead clergy and say, could you teach us about this? Could you preach about this and tell us why we should do it and not be afraid?
So now let's take it a step further, because the Conversation Project is not a religious-based organization, correct?
Correct.
So
Correct.
For others who may not be following a specific organized religion per se, who may be spiritual or not, how are the ways that they can join together, if not only family by family, in community, to begin the discussion, so that in a neighborhood, in a community, when we begin these dialogues, it's a great way for us all to know we're not alone in this conversation.
Mm-hmm. Absolutely. So you could have this conversation with your book group. Let's say take on a great book like Atul Gawande's book, Being Mortal, which has been on the bestsellers list for weeks and weeks and weeks. Very readable, good stories, a little scary to anyone over 50 because he's really honest about what aging is like in America, but it's a great book. And then you talk about it. One of my favorite campaigns is an idea that came out of California and is spread all across the world. It's called Let's Have Dinner and Talk About Death. And so it's an unusual dinner party, but you invite friends, you let them know in advance. What you're going to do is that we're going to have dinner together, maybe have a little wine if that's your thing. And instead of just our usual chit-chat, we're going to have 3 questions that will guide our conversation, and we're going to all talk about it. And these dinners, and you can sign up online and get all sorts of ideas for what to cook and what questions to ask or what movies to watch beforehand. And I tell you, I did this with my family and friends. Yeah. I've done it in college campuses. I've done it with professionals who don't know each other, and it's amazing. People.
What types of questions? What types of questions do you begin, and how do they respond?
So I'm a big ritual person, right? Okay. So my dinner started with a bowl of water in the center instead of flowers, and everyone had a little candle, a little floating votive, and you lit the candle, and then you put it in the water, and you named the name of the person who you want to remember tonight, and you said a characteristic about that person that you carry with you and continue living through that. So, for example, my grandfather was an Italian immigrant, and I lit it in memory of him for all of his courage and what he gave his family to have us live here in America. You know, that I might be that courageous and adventurous. And people went around, and then you have this beautiful centerpiece of this glowing fire, right? Yeah. So another one might be really deep and moving. You know, tell us about someone you know who's died, whose death was really hard for you, and why was it hard? Or if you think about your last hours on Earth, who would you most want to be able to see around you at that moment? Or what does the room look like that you're in? And people just can imaginatively enter into it. Or what would your playlist be? You know, what music would you want to be playing? And those are just prompts, but then it just gets people talking more and more
about what they want and thinking about it.
You know what's the funniest thing, Yvonne? What? People say, oh, we don't like to talk about death. But whenever I go into a group, I always start with, turn to your neighbor and tell them about the time someone died that was important to you and what you remember. And I say, you each have 5 minutes. Well, 10 minutes later, I ring a bell, and I wait, and I have to ring the bell and ring the bell and ring the bell. I said, look, I gave you 5 minutes, and I can't get you to stop talking. We are not afraid to talk about this. We just don't have a lot of safe places to do it. Sure. So the more we create the opening and the questions get asked, I'll tell you, you try it with your next 3 friends. Give them an opportunity to just ask them, so I heard about this idea, and I want to ask you, can we just spend 5 minutes talking about someone you love who died and what that was like for you? You'll be having a second cup of coffee or pouring another cup of tea because it'll just go on and on.
It does, and it's a very touching experience. But it leads me to want to say, though, we should also be having conversations about life, about our lives and how we want our lives to be vibrant and meaningful, and to engage people in realizing, although they have made certain decisions in their lives up to a certain point, it doesn't mean that they can't make different decisions from this point forward, and that you can always have the life, a vibrant life, and to take each day one day at a time and realize that each day is a new beginning, and to go towards the life that you want, regardless of the age that you are.
Right. Well, that's why some movies have been so popular, right? Like things like The Bucket List, or there was a movie, I can't remember who was in it, but it was like this woman thought she was going to, I think Queen Latifah, she thought she was going to die. Right. And then she started doing all these amazing adventures and talking to people like without holding back, but being really generous and really happy and fun-loving, which she hadn't been before. So I think this is an imagination exercise for us all. Imagine you only had 5 years or 3 years or 1 year. How would your life be different? What would you do, or what would you start doing, or what would you stop doing if you thought your time was limited? And just notice for a couple of days. Does that make your life better? And I would say for most people the answer is yes.
And if it does, by having that conversation, then to empower oneself to make the changes that you need to make in order to have a happier, more joyful, more meaningful life. Some people feel so stuck. They feel like they're trapped. They can't change and shift things. But when you begin a conversation like you just had said, you are enabling them to have the opportunity to be empowered, right? Empowered to really look at their life in a different way and again realize what's important to them.
Yeah.
Right?
And I say too that, this is a great idea, but it's not something you should go like rush right out and then make everyone around you talk about it. There's no bullying allowed.
That's exactly it.
You find quote unquote religion around this, and think this is a good idea. Start with yourself and be gentle and patient with other people about it, because it's a little unnerving for some people to think about their mortality or to finally face that it might not go on forever. So be gentle about it. Bring it up as, in gentle ways. Like, remember when this happened to so-and-so? Would you want it to be that way for you? Or how would you want it to be different?
So related to the conversation project,
Mm-hmm.
do you focus and help people to talk about life at younger ages when you were speaking about the college student that goes off and gear it that way to help at an earlier time to begin to talk to one another so that as you go to the end of life conversation, it's a little smoother? You talked about it, a gradual conversation. How might you recommend to our listening audience, our viewing audience, on how they can begin to have conversations that perhaps they haven't had with each other about the caringness of their lives?
Well, we like to talking about this around the kitchen table. Try to normalize it in your lives. Don't have it be just always big, heavy, like, oh, we have to prepare on this and then talk about everything all at once.
Exactly.
No, you can drop things into the conversation. And it can be with, small children, and the fall comes and the leaves die, and it's all a cycle of life. Every child goes through the butterfly who dies, or the puppy, the dog who gets old and has to die. And just talking about that's how it is, and try to normalize it. It doesn't make it less sad. I want to make sure I'm not trying to trivialize by normalizing. And also, just when you see something on a show, in a movie together, or a television show program together, or you read something in the news, a comment about it rather than avoiding it. Don't just not say anything. Say something. And it can just be a little thing like, I wouldn't like it to be like that for me. I would rather be home with all of you. On the other hand, the thing we hear all the time, Yvonne, is the mother who says to her adult daughter, well, if I'm ever like that, just pull the plug. That's not helpful, because sometimes there is no plug to pull, and that's just not helpful. What matters? Why wouldn't you want that? Why would you want that plug pulled? Oh, because I like my independence is so important to me. I don't want to be a burden on you. And then you can answer that. Mom, you took care of me when I needed a lot of help. I can take care of you when you need a lot of help. Don't worry about that.
And what if you didn't have a family member that felt that way?
That's a really good point. So not every person can choose a family member to be their healthcare agent.
Right.
It's very important. Everyone thinks, oh, it has to be my next of kin. No, it can be your best girlfriend. It can be someone you've made an arrangement with in your neighborhood that will do this for each other. If you want someone to be your healthcare agent, that is the legal person who legally would make these decisions for you, you have to ask them, could you respect my wishes? And if they can't, move on and ask somebody else. And we've talked a lot about that this should be a conversation, and we've talked about the letter writing. There is also the need to have a written legal document. And I should have looked this up before we had the conversation. I don't know exactly what it is in New Hampshire, what the form is to assign a healthcare agent.
Yep. It's called the Health Care Proxy. So you put somebody responsible for, and you can get that online in New Hampshire. And You can go, it's specifically, you can Google Health Care Proxy, and then the information will come up, and it will have the living will, it'll have the Health Care Proxy, and a number of other things for people to have. So it's an easy document to be able to get, print off, and begin what you need to do to identify that, which is
Great.
important.
I encourage everyone to have one. If you're 18, have one. Have a healthcare agent designated on your healthcare proxy in New Hampshire.
Yeah.
Definitely.
So,
And then put that form someplace where other people know about it. Share it with people who would be your healthcare proxy. Share it with your doctor so they can put it into your electronic record. And keep it someplace, or keep a note someplace about where you can find my healthcare proxy form.
exactly, exactly. Now, what would you identify as the goals of the Conversation Project, and how do you know when you meet them?
Oh, what a good question. Well, our goal is that everyone's wishes are expressed and respected. So far, we know that we have over nearly 500,000 people have downloaded our starter kit from the website.
And what is the website?
Oh, it's theconversationproject.org.
Okay.
So theconversationproject.org, or just look up the Conversation Project and you'll find a link to it. And there you'll see stories, it's an interactive website. You can put your own story up there, post pictures of your loved ones, find our free starter kits for talking to your loved ones, for talking to a doctor, for talking to a very sick child, and one for families where someone has Alzheimer's. They're available in multiple languages as well. And you can download this and then make as many copies as you want. So that's why we don't know. We're sure there's lots more than 500,000 people have used it, because people make copies and share it with people.
That's wonderful. So go ahead. So you were saying related to your goals and how you know that you've met them. So the project's goals.
So when everyone around is talking about this normally, when we're already seeing some changes in the culture. For example,
what do you see?
Well, although we don't talk or advocate for death with dignity or assisted suicide, depending on how you call this, the fact that Brittany Maynard, the young woman on the West Coast who decided to take a prescription, and she was very public about it, was on the cover of People magazine, and lots of people were talking about, we need to have these conversations about what matters most. So that's happening. There are more and more movies being made about this. It's showing up on some television programs where people are talking, the characters are talking with one another about these issues. And one of the big changes is that doctors are starting to have these conversations. Medicare now will pay your physician, if you are 65 or older, to have a special appointment just to talk about what your wishes are. Before, doctors can be reimbursed for that. But now it is part of your healthcare world, and it's to encourage people to have the conversation. But to try and plan your conversation before you go in to see your doctor so you can make the best use of that time to be succinct in what you want to share.
And what needs to be done to help the doctors feel more comfortable about engaging in that conversation? Because that's not an easy one either.
It's not, but I am old enough to remember that women used to give birth in operating rooms.
Right.
But women changed that. They said, we want this to be different. We'd like it to be a more home-like setting. It wasn't the gynecologists and obstetricians who said, I know, let's have a bed and let's bring the fathers in and have some food. So women, as, quote, patients, mothers, were asking for a change in the system. And that's what's going to happen now, especially as boomers are going to their doctors and saying, I want to talk to you about this because I want to make sure I get the kind of care I want, or not get the kind of care I don't want. So I think a little consumer pressure on doctors is going to help.
Yes.
And I think more and more doctors are beginning to ask the question, is this the best care we can be giving, especially to very old folks? Are we really treating them the way they want to be treated?
Yes.
But to engage in more patient-centered care where we're deciding together. So helping your doctor by saying, doc, I'm not afraid to talk about this with you. It's okay if you want to bring it up. And if you don't bring it up, I'm bringing you my papers next time I see you.
We have, when you go to doctor visits, even the annual visits or whatever else, there's usually a form, an updated form that you fill out, right? You check your medications, you check this, and that, is everything, whatever. And they ask you specific questions. There should be that question. Do you have that healthcare proxy?
Yes.
Would you like to discuss your wishes?
Yes.
so that I know how to best care for you.
And you don't see that form when you go to your doctor's office. You ask and say, you didn't ask me about this, but I'd like you to know.
Exactly. And then to make sure that the doctor has it in their records so that they know that when they're on call, they know how to handle it if they're the ones there for you. But if they're not on call and someone else is there, that they put it in the record in a way that whoever is taking care of you can gain access to your wishes.
Right. And that's a challenge, and people are working on trying to solve it. But another way is you can advocate for yourself as a consumer and say, where will you put this so it can be retrieved in a reliable way, so that when you need it, you can find it. What will you do to make that happen, Doc?
And quickly, too. From what you were saying before, it has to be done quickly.
Yeah.
So from your perspective, how many years have you been with the Conversation Project?
So I've just finished my second year with the Conversation Project. We were founded in 2012, and it was a slower beginning, and now it just feels like it's taking off in leaps and bounds. We're traveling around the country and speaking at large conventions and conferences of doctors and social workers, nurses and financial planners. It's really amazing.
What are you most proud of?
Besides my children,
Yes.
I think I'm most proud of the fact that it has opened opportunities for more people to be bold and to be brave about having these conversations. I'm proud that I've been a conduit for people to have this tool so they can have these conversations, because I think that they are relationship strengthening conversations, and I think that they are life-enhancing conversations.
Have you found the work in any way to be sad for you?
I'm wearing blue and white today, and I often wear black, but it's not because I'm depressed. I just think it's great to wear. I have so much joy in work. In fact, I sometimes think someone should come and take a picture of us when we're all in a staff meeting. Because if you just look from outside the glass windows of our office, people be looking in and think, why are those women laughing? Aren't they the death ladies? We love our work. We love what we do. We think it's making a difference for people in how they live and in how they die, so that more people are dying the way they want to, which so many of us say. We want to die at home, surrounded by our loved ones, without pain, and at peace. And the more we have those conversations, the more we have the opportunity to transform that and make that a real possibility for people at the end of life.
And so from your perspective, to help people to begin this process of conversation, what would you say for them after they're watching this show to think about what they could begin to do right now?
First, don't be afraid. Second, go to our website. Take a look around, read some of those wonderful stories, and then download our free starter kit. And open it up with a cup of tea, read through it, and ask yourself, what matters most to me about living?
And then really think about what you've written.
Think about what you've written and share it with someone. It can be a friend, it can be a sibling, it can be a parent or a child. But practice sharing that with someone and then just notice, how do you feel after you do that? And I can almost guarantee, if you find someone who's willing to listen, you're going to feel closer to that person, you're going to feel relieved that you started the conversation, and you'll be less afraid. And that's what we all want in life, right? Live life without fear.
Have you found, as people engage in this conversation, that there has been a difference in their spiritual beings as far as how they are living the rest of their life now that they've begun this conversation? Are they more at peace that they've began to open up about something that was so important and have been heard?
Well, I don't have long-term relationships with a lot of the people who I meet to run the starter kit workshop with.
How about for yourself personally? You said one of the first things you did was to go through this. What difference has it made to your life?
Well, I think it's the one I referenced before, which is it makes me remember on a day. For me, this is a daily spiritual practice, is to reflect on my mortality. When I was a little kid, I learned a prayer, which was, now I lay me down to sleep. I pray the Lord my soul to keep. If I should die before I wake, I pray the Lord my soul to take. But if I should live another day, I pray the Lord to guide my way. So it was like this little child mantra, meditation on, oh, you could die any night. Now, for some kids, that's terrifying. For me, it was just sort of fascinating. And so I think for me, doing this on a day-to-day basis reminds me that don't waste any time. And also clean out your closets, because it's like...
That's an interesting point. So talk about that, because a lot of times people just leave things. When do you begin the process, when you say clean out your closets, of beginning to release that which you've held on to?
Yeah, well, that was actually a realization I had during a meditation retreat, where we were thinking about if you had a year to live, if you had a month to live. And when it got down to if you knew you only had a day to live, you're thinking about writing letters to people and giving things away. And I got down to the very end and I thought, I've got to clean my closets out. There's just too much stuff in them. And that's been a metaphor for me now, which is letting go of what's just holding you back as much as possible. That thing that's, annoying you, the pants that don't fit, or that grudge that you're holding, whatever it is, try to let go and move on. Either donate the pair of pants or call that person up and say, we need to talk, or I'm sorry, or by the way, I forgive you, whatever the thing is. Let it go. You'll live with a lighter heart. You'll live with more spaciousness. You'll live with more joy, but you'll live with more compassion for yourself and your own mistakes, and compassion for others and their mistakes. We don't have a lot of time. So
and none of us know how much time we have.
We don't know.
We never do know.
And you don't want to live like afraid all the time, looking over your shoulder or wondering, I shouldn't do that because I might die.
No.
Please don't take that message away.
Want to live to the fullest and enjoy each day
as much as you can, and also realizing what's important. So if what's important to me, for example, is being of service, then spend more time doing it and realize I have this great opportunity to be of service in this role.
Exactly. Well, it's a blessing, a true blessing. And, when you were referring to the closets, as we do age, people begin the whole aspect of downsizing. Mm-hmm. And that is symbolic, isn't it? Some say they're going to leave it to their kids, let them handle it. But in that regard, thinking through that also is preparing that maybe it's time for you to make decisions so that others don't have to do that, to make it easier for them. What are your thoughts about that?
Well, I think that's a great idea. I also think it's like, for example, when people my age were getting married, sometimes they got things like china and silver, as wedding presents, and you promptly put it away in a closet and only took it out for special occasions. Yes. What about taking it out now and just using it and enjoying it? Or if it's not something you love, ask your kids, do they want it? And if not, don't burden them with it. Move it on to your a rummage sale to benefit an organization or something like that.
Exactly. So let's talk about this a little further as we begin a summary kind of wrap up as far as within the next 4 minutes that we have of what are the most important things you'd like people to know and to remember about the conversation, about life in general, and about being able to seize their lives as they work towards the circle of life and the ending of life.
So I'd say it's not too early to start. Talk sooner rather than later. Make this as normal a part of the conversation in your life as you possibly can. You don't have to have it all at once. A little bit here, a little bit there. Thinking first about what's most important to you and sharing it with others. Being patient, no bullying. That's very important. Get it in writing would be great. Having a Health Care Proxy form signed where you assign an agent who agrees that they will respect your wishes, and then sharing your wishes with that agent, making sure that they know about it. Don't wait. This is a gift you give your family. Don't be afraid to share this with them. It's really, you are doing something that is going to model how to live and how to die well. It's really a legacy that we give and leave our families. If we can show them how to be bold and courageous spiritually, ethically, mentally, that it's okay to talk about this, that's a great lesson to leave every generation that comes after you.
So very, very true. And from your experience with the Conversation Project, people can learn more about it by going to
www.theconversationproject.org. We have an incredible resource center there. Please look around. It has all the tools you could ever want to bring an event to your organization, to your congregation, to your workplace. Everything's there. We have training calls that are free if you want to become a speaker on our behalf or a trainer on our behalf. There's just, if you need anything, be in touch with us. We create the resources that you need. They're there to share. Join us for Conversation Sabbath this November if you can. But just start talking, because talking really matters.
For those of us in New Hampshire, join us in October 2017, where people will get the opportunity to hear you speak and to engage the audience with some wonderful thoughts about life, a full life, as well as the end of life. This has been a wonderful, wonderful conversation, and a very, very meaningful one. And I can honestly say, engaging you in conversation, you can see and hear your passion for life, and the passion that you bring to this work in making a difference with your work. And I would think, dear Rosemary, that your life should be blessed and full of peace, and that all those that you connect with will also be very peaceful. We thank you for joining the Health View. Please go to the website, and again, let's repeat that website,
Conversationproject.org.
and know that you can download materials there. And remember, you don't need a group to begin this. Start with your families. Start with yourselves. Begin the process of really sharing the conversation of what is most important to you. Let people know how you wish to live. Let people know how much you love them, right? As you said, and be able to create the moments and the memories and the conversations so that you and your loved ones never have any regret. Right, Rosemary? Thank you so much. Blessings to you and all those in the work that you do. Have a great day. Until next time.
The preceding